I don't serve on the health committees. I certainly did not believe that this bill would be passed out of Congress, especially since the bill itself had never been published, especially since the Congressional Budget Office had never done a fiscal analysis. I don't think it'll be out until today. I'm kind of surprised that Congress is even thinking that they could have a vote on this bill. There is an urgency when we look at it and realize that there are constitutional violations in the provisions of that bill, and that creates an urgency. It certainly did for me. It should for every member of the Senate to be very concerned when our federal congressional delegation will be taking up a bill that has far-reaching responsibilities and impacts on the citizens of the state of Minnesota and on the way we do business in the state of Minnesota. And I would like to think that the members of the Minnesota State Senate would be very supportive of this bill to preserve their right to act on behalf of the citizens of the state of Minnesota. We have very powerful chairs like Senator Berglund, who she's essentially an expert on health care. Why would she concede to the federal government all the authority on this issue and not reserve some to the state under the federal Constitution? And the same is true for Senator Pogmiller. He's the majority leader, and yet I see him ceding authority to the governor and now to the federal government. We should be protecting our authority. We are duly elected members of the Minnesota State Senate. I've passed out your oath of office. It is to support the Constitution of the United States and the Constitution of the state of Minnesota. There is nothing more important than this bill. And I'm hoping members will help us here have the full discussion that we should and to weigh in so our Attorney General and our congressional delegation get some statement from the Minnesota State Senate.